My name is Ed Schenkenberg. I'm the director of HERE, the Humanitarian Exchange and Research Center based in Geneva. HERE is committed to closing the gap between policy and humanitarian practice. Through research and exchange, we work to improve the collective performance and effectiveness of humanitarian action. As part of our exchange, I will be talking to 4 humanitarian leaders about the work of their organizations in response to the COVID-19 pandemic. I will be talking with Christina Bennett of the START Network, Kostas Moskokorotis of the Italian NGO Intersos, Raphael Gorgeu of MSF, and Cécile Aptel of the International Federation of Red Cross and Red Crescent Societies about the work of their organizations in response to this crisis. On Wednesday, the 8th of April, I will be moderating a debate with all 4 of them to discuss the implications of this crisis on the future of humanitarian response. I hope you will join me online and don't hesitate to ask your questions through Twitter, email, or on LinkedIn. Hello, this is the 4th conversation that we're having with a humanitarian leader. Today it's Cécile Aptel, the Director of Policy, Strategy and Knowledge at the International Federation of Red Cross and Red Crescent Societies. Welcome, Cécile. We'll be discussing with you how the Federation is responding to the COVID-19 pandemic, and particularly also your role in that. You're the Director for Policy, Strategy and Knowledge. So what does that actually mean in this crisis?
Ed, thank you very much for having me, and delighted to be speaking. We all really need to exchange information and do our best responding to this really unprecedented crisis. At the IFRC, the International Federation of the Red Cross and Red Crescent Societies, we are a membership organization, and we bring together the 192 national societies of the Red Cross and Red Crescent that are active in, again, 192 countries in the world, and that includes China, Italy, Spain, Iran, the US. So clearly, in fact, our national societies of the Red Cross or Red Crescent have been and remain at the front line of the response in every one of these contexts, and also in new contexts as they are emerging, because we're also present in places from Turkey to Bangladesh, and so including then with responses in camps or in conflict-affected countries like Syria. So as a membership organization, what the IFRC does in general and has been doing in response to the COVID-19 crisis is to enable the national societies, our members, to really do their work and to do it as best as possible in those challenging circumstances. So we help support them in their very direct operations, so in bringing resources, including goods and money, to them, in also helping them with expert knowledge, in particular in the areas of health and pandemics. And there is a lot of experience that has been acquired in that area by the IFRC. We were established 101 years ago, in fact, to respond to the Spanish flu. So it's very much the historical background of the IFRC. But much more recently, we really responded to the Ebola crisis with the Congolese Red Cross and a lot of other partners, local organizations, international organizations, obviously the UN, WHO, and many others. So we really try to bring that expertise and really help and support national societies in terms of this. But what we are also doing and really trying to do a lot more than really we have even been able to do in the past is peer-to-peer learning among national societies. I was referring earlier to the Chinese Red Cross. I mean, obviously, as they responded to the very start of what was then an epidemic and not yet a pandemic in China, they really have learned a lot of lessons on what to do, what not to do, including from, containment issues to dealing with people that are very isolated, elderly, that may have no one that support them in terms of doing their shopping, to much more technical issues on how you run the ambulance, how do you protect the volunteers that are checking people's temperature as they move in certain places. So we've been able to really have that learning very early on being conveyed to other national societies, as in fact the epidemics moved from one country to another and became pandemics. So right now we really have a lot of that exchange taking place on all sorts of areas. So it takes me to the part of your question on what is this policy, strategy and knowledge department that I lead. We very much work on the capacity strengthening of national societies and on the knowledge and learning, and also innovation, as well as then, you know, a host of other things, including protection, policy work and other things. But coming back to the learning, we really see as being key. The best way to answer in something that is unprecedented is to innovate and to really learn and to do a lot more of real-time learning than we've ever done. It's challenging, but we are really trying to do a lot there. And it's really very often it's the very, very small learning that really matters. And so it's not only at the level of the leaders of those national societies, it's also volunteers. And we have almost 14 million volunteers around the world, having the capacity for them to exchange experience on issues that range from how do you respond to domestic violence in contexts where people are locked down and therefore can't leave their home, and how do you protect children and you know, partners in this context. But it also goes into other things. I mean, what do we put in the ambulance? What is the equipment that best protect those that really provide the support and ambulance services? So a whole range of topics, from the small ones to the large one.
You already went into some topics in that sense, but could you tell me something more, Cécile, on how that real-time learning is taking place? A lot of webinars, advisory sent out by emails. I mean, how exactly does that take place?
Yes, at all of these tools plus, so we do a lot of capturing through all sorts of media, including Teams, but even Facebook. I mean, we have a volunteers Facebook page where volunteers are able to really exchange tips, and we're trying to organize it. So that's really for the low key, low tech, and on the high end, we're really doing really structured virtual think tanks of not only of leaders of the national societies, but also of specific groups. So people that are, for instance, the health directors, or people, I mean, even on something that is even more tailored than that, for instance, on blood services, the collection of blood, the managing of blood banks in a current pandemics, how does that actually occur? So at all scale, so from volunteers to really technical staff and leaders, and on a very wide variety of means that help transcend the fact that we span really the globe, and also different languages. So we are increasingly trying to do it in several languages as well.
And how much are lessons then applicable from one context to another? Because a traditional way, especially among humanitarian organizations, to say, well, every crisis is different and every context is different and so on. Are lessons applicable from country to country?
So yes, every crisis is different, and there is a lot of there are a lot of hugely important nuances and even differences in dealing with this crisis from one country to another. Actually, even from one part of a country to another. But there are also a lot of common elements. So the more technical the issues are, the more there is learning. So for instance, again, on managing blood banks and blood collection, it's the same issue wherever you are in the globe. On things that are much more to do with community engagement, for instance, on how we communicate to the general public, to try to not only have a positive message on what to do, but also to try to lessen the impact of rumors that may be wrong rumors and lead people to do the wrong things rather than the right one. On this, it's obviously very, very nuanced, but there is still a lot of learning that can occur, especially as while it's very context specific, it is also very age specific. So for instance, young people communicating on TikTok communicate on the same TikTok and you know, across the world to a large extent, beyond the cultural differences, they have a lot more in common. So I think what we're also seeing here is a generational type of communication where in the same generation we can probably, or the same age group, we can probably have a lot of lessons learning on how to best communicate.
Are there any lessons that you could draw perhaps from Ebola or maybe even from the HIV/AIDS pandemic, in the sense of either patients or in fact staff being pointed at in terms of certain stigmatization and some very sensitive issues, but very important to be ahead of that, I would say, and to prevent that kind of stigmatization. Is there any learning that could happen on that particular issue?
Absolutely, you're really right, Ed. There are lots of lessons that we have learned from responding to Ebola and to the HIV crisis. Absolutely, and one that we are unfortunately having to learn, because we see it also in terms of COVID-19, is the stigmatization of not only aid workers but also even medical personnel. It was really difficult for all of us involved in the response in the DRC to see that medical personnel, nurses, clinics were attacked because people misunderstood their role, and in fact even considered that there were places not to heal people, not to provide them with care, but in fact they felt that people would be infected by these personnel and by these structures. And we are unfortunately seeing some of that take place in some contexts now, which is a really worrying signal. And so we're investing heavily with a lot of other partners on community engagement to really ensure that those misperceptions are addressed. It is a bit more complicated in the context of COVID-19 because of the stigmatizations and especially the foreigners being held or felt as that they are responsible for spreading the virus in many different contexts across the globe. So that also we see there the fact that foreigners, and then especially foreign aid workers and foreign medical personnel, may be even more at risk. So yes, indeed, very worrying signal, and some where the learning from Ebola can be key. Let's hope that it doesn't get worse than it has been.
Right. Now, very specific to the model, of course, of the Red Cross, Red Crescent movement is particularly, you already mentioned, working with staff, with medical professionals, other staff, but particularly also with the thousands, if not millions, of volunteers. I imagine that particularly also in terms of their safety, I mean in terms of public health, actually, there are particular issues to make sure that they're not put out in harm's way. What is the support that you can give to national societies, and in turn the national societies can give maybe to these volunteers?
Yes, so yes, the national societies of the Red Cross and Red Crescent are volunteers based. So altogether, we have over 14 million of volunteers in the world, which is a considerable number of people. They are doing all sorts of things. I mean, in fact, very often the president of a national society, he's a volunteer herself or himself. So really high-ranking leaders in our organizations may be volunteers. But we especially have volunteers that are doing all sorts of work at the local level. So it's in 192 countries, but also through 160,000 local branches, which are very much dispersed and on the ground. So these people are not being deployed to help. They're working from within their communities. And that is what often is both protecting them, but also putting them much more at risk, because people want to help in their own communities. And, if it's a question of going and helping your neighbor, if, some people do take a calculated risk, but do take risks. So we feel a huge, and we really put centrally the question of the duty of care for volunteers and for staff. So providing them with the appropriate personal protective equipment is key. And it's of course challenging. I mean, all organizations and all governments even are facing those challenges, but we take that hugely importantly. And there again, the sharing the good practice from across that spectrum where we are engaged is also really helping, so that people can learn from each other, including on the what to do and also what not to do. So we are certainly putting this very, very central. Volunteers are also fortunately often really well trained. I mean, some of the volunteers are, in fact, a lot of our volunteers volunteers are medical personnel themselves that may be volunteering in addition to their work in the medical areas. In certain countries, like in France, a lot of nursing schools are in fact run by the French Red Cross. So obviously we have a lot of medical expertise that is very helpful. But we all know that the medical health workers are currently on the front line and they're taking huge risks. So how we best protect them is really central to what we do. We are also trying to avoid having volunteers go face-to-face. So we are very rapidly transferring a lot of our work online or virtual. So for instance, we've been scaling up hugely our capacity to develop first aid training online, including very specialized first aid. So for instance, first aid for infants. As people are locked down in their own home, being able to have access to online training where they can do their own first aid and then be connected to someone virtually that can guide them is actually life-saving. So we really have scaled that up. We have also scaled up or moved some of our traditional activities virtually. So for instance, in places like Spain, the Spanish Red Cross volunteers had a lot of activities where they were looking after isolated elderly in their communities, going to make sure that they were fine, that they would be taking their medication on time. Now we've moved that by phone conversation, for instance. So we've tried to also adjust to minimize the risk while continuing and in fact even increasing the engagement with communities.
Now, one thing you already hinted at, and I think this is particularly critical, that's also what you said in this response, is particularly familiarity with the local response or with the local structure, the local communities and so on. And clearly there, particularly the local branches of national societies are extremely well placed to know whom to respond, where to find vulnerable people and so on. So one thing that I particularly covered in my blog 2 weeks ago was that the distinction between international, national and local actually may get blurred. Now for the Red Crescent movement, this may be actually a somewhat strange concept anyway, since you actually are international, national and local. But what do you think particularly could emerge from this crisis in terms of actually providing better support to, at these various levels, so to speak, the international, national and local level? How could this really become a more optimal rather than a competitive picture that it sometimes is?
Yes, it's really one of the crucial way in which we are all responding to this crisis is that it has really changed the humanitarian response for most organizations that are used to really deploy people from a center to a country, which involve international travel, taking flight and planes, which is not possible, which includes people being able to travel internationally and get visas. That's also not taking place. And moving with, for instance, their hospitals, their emergency hospitals and all of their equipment, which again also is not possible. So it is really questioning that model and reinforcing the hugely important role that the local actors that are already there in their own communities can play and are playing. As you said, for the IFRC, for the Red Cross, Red Crescent national societies, it's nothing new. That's the way we've been operating. So what we are seeing is that at the same time we are facing increasing demands and increasing needs to really be immediately there. And as you said, not only nationally, but really locally. I mean, it's not good enough to be in Rome if you're going to work in Italy. You really have to be not only also in Milan, but really, much further down to the village in northern Italy that really has the need. For the Red Cross, we're already there. And what we're really hoping is that there will be a lot more support being provided to these actors that are already there and that already not only are there, but know the community. They know within the community who are the elderly, where they live. They may even, in fact, know exactly what is the underlying conditions that they may have. As I was just indicating, a number of national societies like the Spanish Red Cross, but also like many, many others, have been already in contact with these people to help them and support them well before the COVID-19 crisis. So I see that as being not only really reinforced, but we're seeing localization as the only response. It's unfortunately at this stage, and even for organizations like ours, where we're a global network of local actors, we see that in fact what we can do globally to support our own local branches is at this stage reduced by the fact that the demands are so everywhere at the same time. So we're trying to adjust to that. We really have to learn the lessons, because really, frankly, in today's age, the expertise is already there everywhere. So I'm mentioning Italy or Spain, but that's also there in Bangladesh, yes, and it's also there in Syria. So yes, we really need to be supporting our local responders right now, because they're the one on the ground, they're the one delivering the work. Whether we will, as a sector, as a humanitarian sector, learn those lessons, I hope so, and I trust we will. We have no choice.
Right. Well, I'm sure we'll get further into that on Wednesday, the 8th of April. I'm very happy that you will join us as well, together with 3 others. I'm sure we'll go much more in this topic in terms of how can we better respond those who are on the forefront of this response. So Cécile Aptel, Director for Policy, Strategy and Knowledge at the Federation of Red Cross and Red Crescent Societies. I thank you now very much for your for sharing your views, and I look forward to continuing this conversation on Wednesday. Thank you.
Thank you very much, Ed, and thank you here, Geneva, for organizing this, and looking forward to continuing the conversation on Wednesday.